Good evening, everyone. Welcome to the Natural Gut Relief Back to Basics. We are in our Zen mode as I'm getting my IV drip therapy. We have some serene meditation music going on. This is perfect, like right after clinic, just relaxing in the drip room. And Donna got that IV spot on the first time. I hate needles, so I didn't cry, but
you did good.
I did good.
Yeah.
Donna's a IV drip, certified IV drip therapist. She's going to tell us a bit about IV drip, how and if it's beneficial to you. We're looking for questions and comments. As you can see, we are very, very zen, enjoying this. So we're going to go ahead and get started. So Donna, I got my drip in. I am laying comfortably and just kind of resting. And what's infusing in me right now?
So right now what we have is a vitamin C drip. I included a high dose vitamin C, so at certain doses of vitamin C, at low doses is actually pretty good for detox, and then whenever super high doses is whenever we want to push for oxidative to kind of push out all those stubborn infections. We also include some zinc in here. It helps support a lot of the vitamin C absorption and kind of also helps with the detoxification. But we did basic minerals like in vitamins like vitamin B5, B6, B12, as well as a B complex too.
What's the color of can they see the color of the drip? We're going to show you guys the color.
Yep, it's yellow.
It's yellow.
Because of the vitamin B complex, actually.
It's the B complex. So every time there's B complex, it gives you that bright yellow color.
Yeah.
So am I going to pee yellow?
You will.
Oh, I'll pee.
So that's how you know it works.
That's how you know it works?
Yeah.
How many days will I pee yellow for?
I think it's only 1 day.
1 day. Okay.
Yeah.
Okay. So this is the vitamin C. And you said you were going to do a glutathione push for me?
Yeah, we have to do glutathione separately from the bag just because it can react, and you want to get the most benefit from certain drips that are pushes versus mixing in the bag because they can react with one another.
Okay.
So glutathione is actually pretty good for liver support if
Okay.
people are looking for detoxification, especially even with weight loss. So that's really good
okay.
for them.
For the glutathione. Okay.
Yeah.
It's great to see everyone online. Thanks for joining us. We just want to spend some time talking about how IV drip therapy could be beneficial for natural gut relief and whether it's something that you should consider if you have chronic gut issues, right?
Yeah.
So Donna, you're a certified IV drip therapist. What does that mean?
So I actually went through a training with the international IV seminar, and so it was a 4-day course of very intense. We kind of have to do our classes, and they kind of teach us the fundamentals and the basics of vitamin drips, the dosing and contraindications, and whenever it's warranted.
Okay.
This also involves us doing our practical, where we do sticks on each other. We have to pass
Wow.
with like 12 sticks before they would certify us, and we also have to do and sit down for a 50 question exam as well.
So who could be a certified IV drip therapist? Just anybody, or you have to have some medical qualifications and knowledge?
At least some medical qualifications. I saw a lot of naturopaths,
Okay.
MDs, paramedics are also who I've met, and advanced practitioners just like me, PA or NPs.
Okay. Right now, this feels good. Like I'm not feeling anything bad. But can you get IV drip and then start having side effects or reactions? What should we be looking out for?
Yeah, a lot of complications or side effects from an infusion is something we have to watch out for, especially if you're knowing if you're reacting to. So a lot of times people may have shorter breath. Some people might have nausea or vomiting, and it's because sometimes the IV is running way too fast.
Okay.
Because you want to drip very slow, and as slow is safe.
Okay.
Whenever we are dripping way too fast, and it can kind of hemolyze the cells, kind of burst the cells out, and put us into shock. So those are
Oh.
things that you have to really watch out for.
So as you're getting your IV drip, someone should be monitoring
Yes.
some stuff.
Mm-hmm.
Can you tell us more about that?
Yeah. So it kind of starts from the beginning.
Okay.
Even whenever you're coming in and you actually want to do an IV drip.
Uh-huh.
So a good place that would actually, you have to do a careful medical history, making sure they understand if you have any drug allergies, if you have any chronic heart conditions or any kidney issues, because we don't want to push more fluid and cause complications like overload.
So if you have like heart disease, you have to be careful,
Super
right?
careful.
Okay.
Yeah.
Okay.
And so you want to go to a place that's actually going to be asking for your history before you even come in and walk in. That's the safest thing.
Okay.
Then after we do the initial screening, it is even recommended to get some labs done too, especially if you want to do certain types of drips like the high dose vitamin C.
Okay.
At a certain levels, you can't push anymore, just because then there's a contraindication that you might push some people to hemolytic anemia, the G6PD deficiency.
Well, that's a lot of information. Tell me more. When you say people who want to do IV vitamin C, I'll speak a bit louder.
Yeah.
People who want to do IV vitamin C, what is the test that they? Well, first of all, how high of a dose are you giving with IV? Because like when we drink IV vitamin C, right?
Yeah.
It's like maybe 2,000 to 5,000 milligrams, right?
Right.
When you're doing the IV push or the infusion, how high of a dose can you get to?
We stop right before we hit 30 grams.
Oh, 30 grams. Oh,
Yeah.
okay. So that's 30,000 milligrams, right?
Yeah.
So the little sachets of IV is like 1 milligram, but you guys are actually giving like 30 grams.
Yeah, that's our cutoff before we have to get that testing.
Oh, okay. So you can go. So how much vitamin C am I getting today?
You're getting 20 grams.
20 grams. Okay. So I didn't need to do the testing. But
Yeah.
who would you give a higher dose of vitamin C to? Where would you start going above the 30 grams?
A lot of times we do this with patients who are looking for more of a oxidative stressor, like people who have cancer. This is a really good therapy. But also articles kind of looking to vitamin C as part of the protocol.
So this would be for cancer recovery?
Yes.
Right after for cancer recovery. They were using a lot of IV drip therapy, high dose vitamin C for COVID patients too.
Oh, I didn't know that.
They were using a lot to see if it would help, boost the oxidative process. Okay. So important fact for IV drip therapy. We have a question. Someone says they get high doses of vitamin C and glutathione. Is it dangerous? Should you not? Is there like a timeline? Can you get it like every single day? Is there like, should you be dosing over a certain amount of time? I can assume it may hurt your kidneys if you do too much of it.
Yeah, because that's a lot of fluid that's kind of being pushed
in. The fluid,
Yeah,
okay.
And then because we're pushing a lot of nutrients into your system, and it's kind of filtering constantly. And it's a lot of fluids that we're pushing in all at once. So I would probably cut. It's hard to know where you're at from the beginning before we dose escalate, but we always do it gradually.
Okay. So how often should someone be getting the high dose vitamin C with the glutathione in a week? Like maybe once a week, twice a week? What do you think?
I always start safer. Once a week, it's
once
good.
A week,
Yeah.
And then you can up it depending on their response.
Yeah.
And so, what kind of response are we looking for when we start giving things like IV vitamin C? We're talking specifically about patients who are doing it who have a lot of autoimmune disease, and you're trying to like reduce inflammation. Active disease. I know we had used it in a couple patients who had severe allergies, right? Just to kind of boost their immune system, like seasonal allergies or even food allergies. Asthma is another one where we use it. And then you said post chemotherapy, just for the healing process. I think it would also be great we use it in a poison oak allergy patient too, and she did really well. So how do you assess the response after?
So we always do. I wanted us to kind of start doing a lot more of like careful monitoring even after therapy, because this is like a procedure. You know, you're placing nutrients in a patient, and you have to reassess how they're doing throughout the whole process. You have to look at their vitals. You want to make sure that they're not reacting to the nutrients. Because there could be allergies that we're not aware of too. Even aftercare is very important, just knowing how they're reacting afterwards. And part of the side effects with IV nutrient therapy is headaches, a little bit nausea, and that's kind of where you have to watch out.
When do they get headaches? When do people get headaches and nausea? You've told me in the past is when the drip is too fast.
Yes, drip is too fast.
So how long should a typical drip last for?
It can take up to minimum 1 hour, maximum to 2 hours, or actually 3 hours. It really depends on what's in the bag.
Okay.
Because the more concentrated it is, you have to go slower.
Okay.
Yeah. The more volume it is, it has to be slower too.
Sometimes I notice you offer patients a glutathione push or a B12 push. When do you make those recommendations? How do you decide who needs a push?
So the glutathione push is more for patients who are going to detox protocols for weight loss. If they have very stubborn, like SIBO, infections that they're trying to get rid of. And a lot of times whenever they have a lot of heavy metal toxicity too.
Mold toxicity too, right? Mold toxicity. So it's a way to help the body detox even better. Because very often, to support it, very often they have mitochondrial issues and their issues with detoxification. So, you know, we're kind of talking about IV drip therapy in a very clinical and scientific way, probably because you've done the training at a higher level as a physician assistant. You know more about medicine. But what about all these IV drip centers out there? There's so many. Like Restore had a great package. I was going to go there. They had six strips for like, I don't know, $1,200. What is different there than what you would do at a functional doctor's office or someone who's a physician or naturopath who specializes in IV drip, right?
So I would say with those typical places, they're going to probably start with 1 or 2 ingredients in the bag, and that's probably about it.
Simple bags.
Very simple bags, because it's going to be less side effects for patients.
Okay.
Once you start mixing more bags, you actually have to start calculating more, like the osmolarity, like the concentration in the bag.
Okay.
And you kind of sit in a room, like it's not a private room.
Okay.
It's a room where it's very open, like a big living room. So there's someone's on a couch, someone's doing another IV drip right across from you. Yeah, it's like a salon, I guess.
Yeah.
But I think the benefits of being with a functional medicine practice or even a clinic that's actually doing it is because we can monitor the patient and we monitor the progress.
Okay.
We can always dose escalate because we always start low. Okay. With those typical IV clinics that you can just walk in or drop in, then they're always going to start something safe, something low, but it's hard to know how much benefit you'll get if you have chronic gut illness. Okay.
Yeah. So you always said, so you mix your own, you do your own concoctions, like you base it on the patient's micronutrient test. So very often you'll go to a provider maybe who does organic acids testing or a micronutrient test, like with Great Plains or Genova. So we see exactly, they're deficient in all of these Bs. The amino acids are low. Because amino acids are something that you also do the drips with, like specific ones with adding amino acids. So we really customize it, I think. You're going to places that probably would customize it for the patient. That's what you'll see in clinics versus just going to an IV drip place. Do they prepare those customized, or do they have like bags that are prepared? And what's the difference between making the bag fresh and then also just ordering a whole bunch of, bags?
A lot of times that you want to mix the bag at least 4 hours before, and that's how it's fresh. Because the longer it sits out, it's going to start reacting in the bag and with each other, and it's pretty much going to be like neutral. There's nothing. It's just water that's flowing in.
Oh, it's just everything's reacted and canceled out, right? And I hear risk of infection too, the longer it sits, right? Okay.
Yeah.
All right.
And so other clinics, you might even see this, like they'll mix it in front of you or they'll push it in front of you because it's just a saline bag that they're going to push in, and people get that energy just because of the hydration. Okay. And then they start pushing like 1 or 2 ingredients, and that's it.
Okay. Yeah. But here you calculate. So we have a question from Nicole is asking, what is the nutrient cocktail in the IV? She knows there's vitamin C, but what else? Maybe she missed the beginning. We talked about B vitamins, right?
Yes, B5, B6, which is really good for amino acid metabolism.
Oh, I feel so good, guys. It must be the hydration.
Yeah, and then we also throw in sodium bicarb just because of the high concentration. It's very acidic with the vitamin C. You have to neutralize it so it's comfortable for you. Okay. We also add in zinc and then also B12 too.
Oh, okay. Yeah. Okay. Can you tell us a bit about the amino acids? Who would that be helpful for? I know you guys add some
Yeah,
amino acids.
so amino acid, we put it in our detox protocol.
Okay.
This is really good for even patients with that are malnourished, losing weight, because the amino acids are good building blocks just to kind of help build up muscle and immune recovery.
Mm-hmm.
Even sometimes with amino acids, it's good for athletic recovery,
Mm-hmm.
and people who are losing tons of weight. I think that's where they need the most support. Yeah.
So, oh, that's helpful. So there's a lot of stuff. I mean, IV vitamin C, amino acids, B vitamins, glutathione. What else? That's that mostly it.
Oh, calcium and magnesium.
Magnesium support.
Yep.
So
Mm-hmm.
actual micronutrients, essential
Yeah.
nutrients as well. Excellent. That's really helpful.
Yeah.
So for our patient, for people who have gut issues, because this is a natural gut relief group, how may it be beneficial for someone who's been suffering from chronic GI issues? Let's take the example of someone who just has bad diarrhea, right? We don't even know the cause, but they have bad diarrhea. We can assume that they're probably not absorbing a lot of the liquids or nutrients through food. Would IV drip therapy be helpful? And if that, which one would you recommend? What type of blend?
So I would say with anybody who's having diarrhea, first off, they're dehydrated.
Mm-hmm.
You definitely need to replete them with at least normal saline water just to kind of get them rehydrated.
Mm-hmm.
So patients with diarrhea, and first off, they're not absorbing anything. Even if they're eating something, it's just going to run right through them. Okay. So that's why there's a benefit of the IV therapy, because it bypasses the gut and it goes straight to feeding the cells the nutrients and the minerals that they need. Mm-hmm. And so, with that being said, other things I would actually replete with someone who's having chronic diarrhea is just basic vitamins and minerals. It's good to kind of start off with that. And anyone can really benefit with it too.
With the IV drip, okay. Does it burn? I don't feel any burning. It actually
if it burns, it's not a good
it's
IV.
not a good So it's really important to make sure that everything is done. Like Donna had gloves, mask, alcohol wipes, cleaning the area really well, keeping the area clean and still. So really being very clean. Because if someone puts an IV and you're not doing it under like sterile environment, you could get like a bacterial infection of your bloodstream.
Yeah,
right?
And
that's one of the biggest complications, right?
Phlebitis. Yeah.
Yeah. So in our patients, for example, with inflammatory bowel disease, who we know they're not absorbing, what kind of, would you give them like a Myers? What would you give them?
I would start with the Myers first, see how they tolerate just a first IV drip. Afterwards would be really good to start adding a little bit more of the amino acids to kind of help support them, and even with detox to kind of help, like glutathione especially, just so that we can support the liver, help reduce some of the inflammation too. Vitamin C is very good because what if they're more prone to infections? Yeah.
I've recommended it, through studying functional medicine. I've read that it could be extremely beneficial post-surgery as well with wound healing.
Yep.
So in some of our patients who had breast implants and got them removed because they had breast illness issues that led to gut issues as well, after they get the breast implants removed, they do extremely well with sessions of IV drip therapy. Like we're thinking of the same patients, right?
Yeah.
They've done extremely well coming in 2 to 3 times a week and getting IV drip therapy. It's worked really well. And for my patients who have, I think a big benefit that I see that I always go to Donna for recommendations are for our patients who have small intestinal bacterial overgrowth and small intestinal fungal overgrowth, who sometimes we start them on an elemental diet because we're really trying to rest the bowels completely. So they're not eating regular food. They're on these elemental shakes. They need the volume and they need the other nutrients to just infuse. So they do really well with IV drip therapy. And then the die-off symptoms. Can you tell us more about how it helps with die-off?
So whenever we have die-off symptoms, it's typically like headaches, nausea, and it's like your body just dumping all the toxins
and
out.
Releasing. Yeah.
So this is where we do a lot more support with glutathione, just so that way it can kind of just wrap up and calm down the support the liver to also get rid of the waste.
To support the liver. So it's a great liver support. Awesome. Okay. This feels great, guys. I feel relaxed. The IV does not burn. I feel like I'm getting hydrated, and that's really good. So, okay, so there are a lot of places that are doing like IV hangover drips and stuff like that. What do you think about those? I mean, I think if you have a hangover and you get an IV, you probably feel
A lot better. Yeah,
rejuvenated.
just the
Yeah.
hydration would really be
Yeah.
helpful. But I think our focus here in the what Dr. Asamoah and what she's trying to do is actually help heal patients who need it because they have chronic gut issues, and we're trying to restore the nutrients and vitamins that they need to repair.
Okay.
So
Yeah.
then they can recover and get rid of it.
Okay.
Yeah.
Okay. So sometimes I think there's a role for IV drip therapy instead of supplements. Because when you give the supplements by mouth, if the person is still having a lot of chronic gut symptoms like diarrhea, bloating, and not absorbing, the supplements are probably going to get washed out, right? And so them actually getting it through IV helps restore the cells a little faster initially. And then once they're healed or there's healing process, then you can add on the supplements. That's really good. Yeah. Oh, great. If the IV is going too fast, you can get symptoms, right? Yes. So that's, you have to be cautious, make sure it's not going too fast, like nausea, vomiting, and stuff like that. All right. So we talked about IV drip therapy being helpful for people with allergies, asthma, people going through chronic gut issues like diarrhea, inflammatory bowel disease, SIBO, SIFO. We talked about it, and even short gut symptoms. People who've had like small bowel surgery and are not absorbing could do very well with IV. We talked about the benefits post-surgery. So we talked about breast implants, but this could be any abdominal surgery, gut surgery, just kind of for wound healing. And I would see the high-dose vitamin C for something like that. And we talked about some benefits of IV for even weight loss programs as well. It says, since this is in the blood, how does it affect or help the liver? Well, everything in the blood definitely goes through that portal vein, right? Everything in the blood that eventually gets into red blood cells passes through the liver to help detoxification and cleansing. And so it then carries anything bad from the liver, also by helping it flush through the kidneys through hydration. So everything you give through the blood, like anything you eat, eventually makes it into the bloodstream. And so what we're trying to do here is actually bypassing the gut, infusing straight into the bloodstream, where it's going to pass through the portal veins, the hepatic veins, and go into the liver to be used. Right? That's where a lot of these nutrients are actually used, is liver and then cleansing through the kidneys, right? And then we have another question about how often should you do this before you see a long-term difference?
So I think a lot of times, this is my general feedback for most patients, that they start getting instant, like just a boost of energy. It's very subtle within 24 to 48 hours.
I can't wait. Tomorrow I'm going to be on fire.
And then I guess with a lot of times, it just depends on how severe their illness is. That it may take like a month to kind of, or through a series of IV drips, and how often you're going. So let's say if you're going twice a week for at least a whole month, I guarantee by the end of the month you start feeling a difference. But depends on how sick some patients are. They might need to see if they're having less diarrhea. Are they absorbing more? Are they able to tolerate more food and having less headaches, nausea, things like that?
It sounds to me like, from what you're saying, Donna, what I'm hearing is that you shouldn't need IV drip therapy forever.
No.
If you need it forever, then your medical treatment is not going well. Because hopefully the diarrhea gets better. Your absorption gets better. And what we always want to do is use the gut first. Right? The gut should be, the natural way of the gut should be what to help absorb foods and everything. We got a question about how it helps with chronic fatigue. This goes back to root cause, right? What is the cause of the chronic fatigue? We see a lot of fatigue with die-off. We see a lot of fatigue with stealth infections like mold infections, with Epstein-Barr, Lyme, Bartonella infections. And so the question is, if you're having chronic fatigue from those issues, that definitely has to be resolved, right?
Because as much as we give all these IV nutrients, it might be temporary relief, but we haven't
addressed. It's not long term. You haven't addressed the main issue. It's more like supportive care. There's a question about if we've developed something for fatty liver patients. There's one that we
Yeah.
had for fatty liver.
Yeah, we actually have two.
Okay.
One is the infrared sauna, and then we actually have the Lipo B12 injections. What it contains is the methadone, inositol, and choline with the vitamin B12, and it actually helps support the weight loss with it. Um, that's if you just don't want to do the IV drip, you don't have time for it. So then we also have the um, liver detox, which we kind of been talking about the same detox protocol, and it includes the glutathione. Yeah, and that's where it helps with weight loss and also fatty liver.
What I also learned about the glutathione is it goes through that whole N-acetylcysteine making glutathione, which reduces oxidative stress in the body, right? And very often when people have chronic liver issues, that process does not work well. And so a lot of patients with liver issues like fatty liver, we often give them natural supplements that have N-acetylcysteine, that have, what's the other one we use a lot?
NAD?
NAD, that has, of course, vitamin C, vitamin E, and then milk thistle, things like that. But we know that the half-life of the NAC is very short. And glutathione, when you actually take it by mouth, it breaks down really quickly, which is why we prefer, if we're really wanting to push that oxidative stress reaction, we prefer the glutathione push. Yeah. How much of a dose can you give for the glutathione?
I've been doing a lot of research to look for the glutathione cutoff. So far, I haven't found it yet. There's a lot of research with patients being treated for Parkinson, and they kind of have gone up to almost 100,000.
Oh wow, that's a really high dose.
Yeah,
but it acts really within every cell to improve the function of the cell, right? So for fatty liver, ideally, you're kind of putting them on a speeding up their metabolism and improving detoxification. And so that would be infrared sauna for detoxification, Lipoplex B shots for high dose vitamin B, as well as Lipoplex amino acids. And then finally, the IV high dose glutathione drips, right? And that would be a nice process to do for maybe about 3 months, 6 to 8 weeks.
Yeah, I think 3 months to
3
kind
months,
of find a big difference.
Yeah, that sounds really good. Any other questions we have before I close my eyes? Can you mix and match like vitamin C and Myers, mixing the different components of the drip?
So the vitamin C already has the Myers in it.
It has
for
the Myers in it.
Okay. So what we did was we increased the vitamin C inside, but also had to balance the pH with it so it doesn't burn and it's more comfortable for the patient.
Oh, I see. Okay. So who should not get IV drip therapy?
I'm going to say patients who have cirrhosis with
decompensated cirrhosis. Yeah. Because you have a lot of patients with cirrhosis who are doing just fine. They're compensated. Everything's fine. They're just trying to lose weight. They can get it. But if you have decompensated, like fluid in your belly, fluid in your legs, right? We don't want to add more fluids. Okay. Who else?
Chronic kidney disease issues, and also congestive heart failure. Those are big ones.
Yeah. So that's why you were saying, like, if you do go to a drip center, it's really important to make sure that whoever's checking you in is really asking all of these very important medical questions. What about if you're pregnant? Can you get IV drip, like all these concoctions? Would you do it on a pregnant patient?
I'd be careful.
So you'd probably just give normal saline if they're dehydrated. Just give them saline if they're dehydrated. That makes a lot of sense. Any other questions out there? Anything else you want to share with us, Donna, about IV drip therapy?
If anyone wants to try it, I mean, I think it's worth trying.
It's worth trying.
At least make sure that you give yourself the time. And I think it's very important. I mean, just being here, giving yourself the time to even experience an IV drip, because I think it's good to just give yourself time to shut away.
Like 2 hours. Oh, just downtime.
Because you don't give yourself time to do anything until you've done an IV drip to kind of just relax.
It's just a relaxation time. So we have our little music on, our meditation music. I'm not sure I'm going to be able to meditate throughout all that because I have some work to do.
That's what I'm talking about.
No, okay, I'm going to meditate. I'm going to shut my eyes and I'm going to do this IV drip. But it feels good. I feel I feel like I just drank a ton of water and I feel like I got a boost of energy. So how much more time do I have on this trip, Donna? Because I gotta go do stuff.
Well, I gave you the vitamin C, and
Okay.
so typically we do things slow just so
Okay.
that way you don't have reactions.
Okay.
I should have given you a smaller volume, I guess.
It's okay. I
Yeah.
can do it. I'll stay. It's probably worthwhile. Somebody had one more question about breastfeeding, and then, guys, we will shut off. What would you say about breastfeeding?
I'm going to be honest, I don't know too much about that part.
Yeah.
Yeah.
We haven't had any patients needing IV drip therapy who are breastfeeding. I probably wouldn't do it. I would be very cautious in my anyone who's pregnant, and I would be very cautious in anyone who's breastfeeding. That would be part of my probably for now my no-no list, right? Along with people who are on many medications where there could be interactions. I think you definitely have to see a provider who knows what they're doing and not just go to any center, right?
Yeah.
So what we're trying to do, I think wherever you go to get natural gut relief, and if you want to incorporate IV drip therapy into your treatment protocol, make sure you're going somewhere where they are customizing the care for you. That's the most important thing, right?
Yeah, because you can always go up, but it's very important for them to know how you react.
Yeah.
And so I think that's why you should stick to a place that's going to be monitoring your lives regularly too.
Yeah, that's true. All right, guys. Thank you so much, Donna. This is nice. I feel like I got a treat today.
You deserve it.
I deserve it. Thank you, guys. Have a wonderful evening, and we'll see you next week, Thursday, for another session of Back to Basics. Thanks for being a part of the Natural Gut Relief Group. Send us questions if you have questions. This was awesome. There were a lot of awesome questions from you guys. And let us know if you have any more questions or concerns about IV drip therapy as part of your gut healing process.
All right.
Bye-bye.
Bye, guys.